know how fast this 10 minutes goes, so I'm going to be speeding through this one because I've noticed when we get the 1 minute, everyone goes, me included. All right, so our acknowledgements are done. So I wasn't actually supposed to be doing this one. Samana, I'd like to acknowledge Dr. Samana Thompson and the rest of the Physicards team. Samana's actually presenting down at SMHR, so I was the last one standing. So we actually originally had some conversations with Jade Riddell around the Flourish Physicards to look at joining the New South Wales random control trial as a South Australian arm, but we were too late. We missed it by that much. So our next step was to consider what it looked like for us here in South Australia and where we could potentially get the best data and have the most impact on using the Physicards for improved physical health of our consumer group. So we needed to convince the Rehab team of the plan to use Physicards in a care and co-design study around their use. And fortunately, I have fairly good relationships with most of the team managers, so it wasn't too hard to twist his arm. So we have got some really great people who are keen to give it a go. So I was happy with that. Now this is actually the New South Wales trial paper, which was published in October, and what it actually showed is that the participants who utilised the Flourish Physicards were significantly more likely to identify that they wanted support for a physical health concern. So that was reassuring. So what we did, once we'd sold the plan and pulled the team together in the Callan Rehab team, our southern colleagues at the Trevor Parry Centre, they were happy to be our treatment as usual cohort, and the director of our Wandaka, which is another community rehab in the north, has agreed to be our control group. So the project team's a multi-D team consisting of lived experience peer specialists, nursing, allied health, social work, OT, medical and academic researchers. And having Sumana, who's a consultant psychiatrist, involved has been brilliant because she's actually currently doing her PhD in health literacy, and that's really helped to shape the project. So we did this great brainstorm activity, which probably posed more questions than not, but it actually gave us a lot of really rich ideas too. And it was a really good time because it was very beneficial for allaying some of the staff's trepidation regarding scope of practice. So they thought that if we were introducing a Physicard assessment, that it was going to take away from their nursing assessment. So we were able to work through that, and we were able to clarify the current practices that occurred in the service that wouldn't be replaced but hopefully enhanced. Well, that's our hope anyway. So it was important when we're considering our design to look at the importance of health literacy to be an integral component, and we looked at the WHO Charter for health promotion, of which health literacy is a key component of that. So when our goal is to determine whether integrating the Physicards into the routine physical health screening improves a person's outcomes of quality of life and their functional status. And we wanted to ensure that the residents of the community rehab centre were actually involved in the design process as much as possible, right from the flyer design and testing the Physicards. We needed to look at time to administer in relation to their admission processes and what that actually looked like around that, and for people who've already been in the residential community, and what the location of the activity was too. So we also road tested some health literacy tools with the staff to select the ones that we thought that were both comfortable, that we were comfortable with, and those that we thought had the best accessibility for the residents. And we needed to question if we were doing a quality improvement project or whether we were doing a research project that then required ethics. And it was important that we actually had executive sponsorship as well. So we had to do a briefing paper, and fortunately our Callan Projects Board committee has gave it approval. So now we report every 2 months, and our report notes for our team notes actually just is what we use to report up Teams is used for all of our documentation, and we've made sure that the project aligns with all of the Equally Well consensus as well. And evaluating the health reflection tool, the study aims to provide evidence for a tool to improve physical health and well-being for people with a living experience of serious mental illness. And we hope that if it goes well, that it can be adopted in other areas. So there was things that we can do while we were waiting for the ethics question to be answered. So we looked at the measures that we would use along with the general physical health parameters, and we looked at the two health literacy tools. And the ones we chose were the Realm and the newest vital signs, along with all of our other standard measurement techniques that we use. So this is the rapid estimate of adult literacy in medicine. It's we call the Realm. And this is to make sure that we provide the best education information for a person. And what they have to do on this is they actually read the list, and it's scored for the questions or the words that they can't pronounce. Then there's the newest vital signs literacy, where they actually look at a person's ability to read a label and decipher the information. And both of the Realm and the newest are well-respected and tested health literacy tools. We're also looking at using the goal attainment scaling, or the GAS, and that's to record each person's identified health goals. And noting that in the early design phase, when we were doing this and testing the Physicards, some of the residents only identified one issue that they wanted to work on, and that posed quite a dilemma for the staff. They were going, well, surely they've got more, they've got diabetes and they, all of these other things, but they only want to work on one thing, and we went, one's better than none. And it's very much working in a person-centred approach. So one goal that the person can focus on provides a really good basis to start from. And our view, as I said, is one's better than none. And it's also a way that they can test the water. And it might be all that the person can manage at that point in time. And, of course, we're going to work with what we're given. So while we sprang out of the gates with enthusiasm, it seems to be a bit of my... wishful thinking here. There's lots of things that slowed our progress. It's a bit like the good news, bad news, children's books. So the Realm posed as a question, can we alter two words? There's two words on the Realm that we just don't feel are appropriate. We feel that they're quite triggering. So can we change that? And that's a whole project in itself. So for purposes of that, we're actually trying to gain permission to do that. The second hurdle was that our project now actually requires ethics, but that's not a problem because everybody loves writing ethics. No, they don't. So while the delays are part of the course, they are necessary. And so while we are still moving forward, we are moving forward at a lot slower pace than what we actually thought we would be. The poster or the flyer is co-designed with the LPDA residents, and that's undergoing changes in response to their feedback. And the last round it's just still way too busy, and what we really want is somebody to actually explain the project to us. So that will be happening in the community teams. And then when they tested the Physicards, the first time they tested it was in the treatment room, and there was just no room for it. There was nowhere they could do that, so we've moved on to an activity room instead for that. And the activity takes about 20 minutes. So while we're waiting to get the ethics done, we're still able to do a lot more learning along the way and hopefully create the project so that we can refine the processes as we go, so that once we get that ethics, we'll be able to hit the ground running. And we just hope that that will be a positive thing. So, of course, the plan is get the ethics approval, refine it, collaborate with our other areas, do lots of PDSAs, and hopefully, if it works well, use a step wedge approach for the other areas. Oh my God, 10 minutes.